Recently, comedian Raju Srivastava suffered a heart attack, and the incident has brought the focus back on how crucial it is to take care of your heart. Now, today we have with us Dr. Ashok Seth, who is the chairperson and cardiologist at Fortis Escort Heart Institute, Delhi. Thank you so much, Doctor, for taking out time and speaking to me.
Pleasure speaking to you.
I'd first like to begin by asking, it's not just Raju Srivastava. There are so many other people in their 20s, 30s, 40s who are getting strokes. Why do you think this is happening?
So I think firstly, we've got to understand that over the last 20 years, heart disease in the young people has been rising.
Yes.
We have clearly seen that the heart disease in young people has risen by 200% over the last 15 years.
Yes.
And we are 10 years at a younger age predisposed to have heart attacks than the West. So the average age is 56 to 57 in India, as opposed to 68 to 69 in the United States.
Okay.
So that's the second aspect. And the third aspect is that we're not just the heart attack capital of the world, but you're also the diabetes and hypertension capital of the world.
Yes.
And these are important risk factors for coronary artery disease. Coupled with that have been lifestyle changes. Clearly, the fact that people are exercising less, more glued to sitting down and working. The atmosphere of competitiveness has increased, so stress factors have increased.
Yes.
Eating out has increased, so trans fat foods have increased. Sedentary lifestyle has become more common, under stress all the time, meeting deadlines in the younger group. And finally, pollution also has a part to play. So all this combined together is a multifactorial issue about rising heart disease in young Indians. To tell you frankly, in the West, death from heart attacks have gone down by 50%, while we have risen by 200% during the same time period. So it is an important problem and has been increasing over the last 15 years.
Right. I think you mentioned one very crucial point here, that is lifestyle. Now, especially in the last 2 years, Doctor, we've seen reduced physical activity, gyms were closed, a lot of people were not working out as much. And all of that, together with sedentary lifestyle, as you mentioned, there's been an increase in diabetes, hypertension, smoking, alcohol habits. All of this together has really taken a toll on human health. Now, there's another aspect to it. A lot of people have asked us, it is always recommended to work out and do some physical activity to stay healthy. But a lot of these recent deaths that happened when these people were either in the gym or they were working out. So how much working out is actually healthy?
A very important point, and we talk about lifestyle diseases.
Yeah.
And that's true. Lifestyle diseases are all taken care of by healthy exercise.
Yes.
You raised a very important point, and I want to re-emphasize that. You raised smoking, and I tell you, smoking has increased tremendously.
Absolutely.
Over the last 30 years.
Yes.
And that I still want to advise your viewers is the biggest, most important risk factor for developing heart disease as well as heart attacks, especially in young people and especially suddenly. For example, some of the issues you raised about people severely exercising and getting a heart attack happens commonly more in smokers than in non-smokers, because that leads to thickening of the blood. Right. And suddenly on increased exercise or heavy exercise or severe exercise, clotting precipitates in the heart coronary arteries, especially in smokers, to result in sudden cardiac death or a sudden heart attack.
Right.
So now the very important aspect you raise is that because certain celebrities had heart attacks during exercise, during gymming, or after heavy exercise, has they raised the concern about exactly what you asked, is exercise good for the heart, or what sort of exercise is good for the heart? So we've got to realize that exercise does decrease heart attacks by 25%. But the exercise we say is aerobic exercises for approximately 40 minutes, 5 times a week, which sums up to 200 minutes, more than approximately 200 minutes a week, which therefore means you have a 5 minutes of warm-up period, 35 minutes of brisk walking, and 5 minutes of cool down.
Right.
Brisk walking is termed as a speed at which you're able to speak one sentence adequately, but cannot have a conversation with your friend, or are not panting for one sentence. That is heart healthy exercise. Anything beyond that, or anything for a more longer duration, only helps your stamina, may help weight loss, but is not necessarily any more beneficial to the heart.
Right.
Severe anaerobic exercises like weightlifting, like heavy gymming, etc., are good for your muscles, good for the physique, good for looking good, good for feeling well, but not necessarily good for the heart. So when we talk about these situations, what sort of exercise can precipitate a heart attack? I've told you what sort of exercise is good for the heart.
Yes.
But what sort of exercise can precipitate a heart attack? So it's not that people who run for 10 kilometers or 15 kilometers or who run marathons have to be worried about it.
Yeah.
Actually, if you take up gradually any form of exercise over a period of time and build yourself up towards it, then that is customizing your body to that exercise level and capacity. But if I suddenly decide that I'm not accustomed to exercise and I said, today I'm going to, whatever may happen, run 2 kilometers, and I've not even run 500 meters in my life, or I go to gym and don't build myself up and say, let me start lifting 50 kilograms today, and whatever may happen, I'm going to exert myself so much and use every muscle. Those are the sort of ones which precipitate heart attacks. So severe, unaccustomed, rigorous exercise can precipitate a heart attack. The third aspect we must say is that is the very important factor that unaccustomed exercise is bad, and therefore if someone does believe that he now wants to transfer from moderate level of exercising, which is good to the heart, for example, wants to climb mountains, wants to go to the base camp of Himalayas, wants to actually do strenuous trekking, or some strenuous, then certainly cardiac checkups before that unaccustomed heavy exercise is important, so that these things happen. And smoking, of course, like I emphasized, is one of the important factors which precipitates clotting, and severe exercise can also precipitate clotting, and the two together form a bad news.
Absolutely, doctor. Doctor, how crucial is walking to keep your heart healthy? Like we've seen in Western countries, a lot of people like to walk. But in India, we have more of a, this may be a generalized opinion, but there is more of a concept where you want to have a built-up body. Now, a built-up body need not necessarily be healthy. Do you recommend walking for people?
I think you hit the nail on the head. Exercise, gymming, building muscles is not necessarily heart healthy. It is good for physique, it is good for general looks, etc. And yes, there's a trend towards gymming. We're not discouraging gymming. We're just saying that, remember, just the fact that you've got muscles built up doesn't necessarily mean that you're cardiovascular fit. Absolutely. And that's not cardiovascular exercise. But that is where we come. Brisk walking is the best form of exercise. And when we say not casual walking, you have to increase your heart rate to a particular level for a sustained period of time and then bring it down. Now that can be split up. By the way, I told you 200 minutes a week, which translates into 40 minutes 5 times a week. And yet 20 minutes twice a day can also supplement the same. So you have got to get to 400, approximately 200 minutes a week. But that doesn't mean that you do 5 minutes of walking or 5 minutes 5 times a day. You have to build up the heart to a particular level and maintain it at that level and then bring it down. You said about walking, absolutely. Brisk walking is the best form of exercise. We say even running doesn't add on anything. It adds on stamina, it adds got you feeling good. And of course, in terms of weight loss, the more exercise you do, the better it is. But that is aerobic exercise, and therefore you got to do it over a longer period of time.
Yes.
And therefore, and we know that running is a great exercise, except that sometimes it's not so great for the knees, especially running on the pavements and streets.
Yes.
Now, in India, the realization of exercise, unfortunately, means gyms and building up bodies, okay, or weight loss and training.
Right.
But like we've expressed about the heart healthy exercises, I also want to maintain the very, very important factor that when we talk about heart healthy exercises, we also have to believe that people say, but I can't do this. I haven't got time.
Yeah.
But even at work, even just parking your car at a distance from where your office is and saying, I'm going to walk this 15 minutes to my office, or during office, actually going up and down the stairs, including lift, is heart healthy exercises. Right. Taking that tea time off and saying, let me do, instead of having a cup of tea with samosas, let me just go up and down for 15 minutes, down the stairs, up and down. That's heart healthy exercise. So you can build it into your day. The exercise can be built into your day. And when you said, again, a very important factor you said was you see that in the West, people walking, people exercising. And you're not wrong. I did a survey which was published in one of the national dailies, and I surveyed 1,000 people. This is going back 10 years ago. Surveyed 1,000 people who were walking in the gardens in the morning, and you see a lot of people walking. Well, the average age of people who were walking was above the age of 60. There were hardly any youngsters. The second aspect was that when asked as to what they suffered from and why were they walking, they said because they'd been advised to walk because they'd already suffered diabetes or heart attacks, or had hypertension. And so it was a reactionary process. It was not a proactive to prevent heart disease. 70% of those had actually already suffered from heart problems and were doing it on the advice of doctors. So we are as counteractive in our approach rather than proactive. And that's why we don't see youngsters doing brisk walking and exercising, but we see a lot of them in the gyms.
Absolutely. I think now that you're mentioning it, I have noticed it. I mean, a lot of Indian families as well, the elders in the family choose to go for walks, but the youngsters are seen hitting the gym. So absolutely, I think that's a very crucial point that you made. Another question, doctor, there's been a lot of growing connection and debate over COVID-19 and heart attacks. Now, do you think those who've been infected with COVID-19 in the past need to take some extra precautions?
Yes, we do. And firstly, let me just state the facts as they stand today.
Yes.
COVID does affect heart attack. And I've said this before, that COVID is not just a lung problem, it's also a heart problem.
Right.
And it affects the heart in multiple ways. It increases clotting of the blood. And so young people have had heart attacks related to COVID infection.
Yeah.
The second aspect is that it affects the heart muscle, causing inflammation of the heart muscle, leading to decreased efficiency of the heart, what we call heart failure and decreased pumping efficiency. Right. And thirdly, it's also affected the conduction system of the heart and irritability of the heart, leading to fast heart rates and irregular heart beating and so on and so forth. By the way, while that happens during COVID and often in the recovery period, up to a period of 3 months, what has been clearly pointed out is that it's even longer than that. And long-term effects of COVID, even mild COVID, not necessarily just severe COVID. It's clear severe COVID also leads to more heart problems, but even mild COVID can also lead to heart problems over a long period of time, up to a year, with a 60% increase in heart attacks.
Yes.
So yes, COVID does pose a problem. And therefore, for all people, young people especially, who've recovered from COVID and who want to get back to exercise and say, but I was exercising before, I used to run 10 kilometers. Yeah. I'm fit, I've got my, it was a mild COVID and nothing happened. I want to get back. And they're just 2 weeks into recovery or 3 weeks into recovery. We say, hang on, you've got to take it easy. You've got to build yourself up gradually over a period of 3 months. Build yourself up to original level. And often in those people, we certainly do 2 important tests. We look at a 24-hour recording of the heart, which tells us whether there's a heart rate variation, whether they do get palpitation. And the second thing we do is an echocardiogram to see whether the heart pumping efficiency has not been affected by COVID. These two important parameters are a must for people wanting to get back into exercise and wanting to get really back into a real normal life. But again, with precautions that it has to be built up, it has to be slow. And heart symptoms, which is palpitations, chest pain, any form of ghabrahat, sweating, etc., should not be ignored post-COVID.
Right. Doctor, since forever, heart attacks and strokes have been known as the disease of the old. But now, with all these recent reports coming in of very young people dying of heart attacks, people are scared. But they're also scared because they are unable to identify the factors or the kind of symptoms that lead to heart attacks. So what is your message for the youth or people in their 20s to 40s age group who are scared? What do you think they should look out for?
I think that it is not a matter to be scared. It's a matter to understand and absorb that we as Indians have the major risk factors for developing heart attack. That's why we 3 times more vulnerable than a Caucasian, 6 times more than Chinese, and 20 times more than Japanese to have heart attacks. Anywhere in the world, Indians who've been even 3 generations and 4 generations, say in West Indies, in Singapore, and 2nd generations in the United States are still, having never lived in India, never absorbed those habits, are still prone to have heart attacks. So we have to remember that. Secondly, some of the important risk factors are well known to people, but actually, again, we need to remind them about it, that family history is a very important aspect. If there's early heart attack or deaths in the family due to heart attacks, in parents less than 60 years, for us, it constitutes a strong family history. And therefore, those with a strong family history, firstly, should never take up bad habits, which therefore means never take up smoking. If they've got diabetes, get it under control. If it's hypertension, get it under control. Don't be obese. The reason is that this is not just an add-up factor. If we have a family history and we add diabetes onto it, it becomes 6 times more likely to get a heart attack. And we just add obesity or raised cholesterol levels to that, or smoking to that, we got 18 times the risk of a heart attack. So while the family history is not under our control, what is under our control should be firstly taken care of and removed from our life completely, which is, then third aspect is that those who are vulnerable at early age, which means a family history of those who develop diabetes at an early age, smoking to rokna hi hai, smoking to I wouldn't even consider as as something, it's something you are doing to yourself. So smoking, leave aside. But there's hypertension, diabetes, there's raised cholesterols, which are passed down in family, which sometimes you don't have control over. And therefore, those who have these risk factors should get checkups done regularly. So I say for all males, if there is a family history, your checkups of blood and identification of risk factors, because hypertension can be unknown, can be can be unfelt. Diabetes can be unknown or unfelt. Cholesterol levels can be unknown and unfelt. And this is the checkup that you actually have with a doctor to identify the risk factors. And that should start at the age of 20 in those with a family history. In those who have got no risk factors, let's assume there's no risk factor. One checkup definitely in your late 20s to early 30s is important for all men and women to identify the risk factors. I say by identification, you're not going to a doctor for advanced tests and exhaustive investigation, but just identification of risk factors so that early prevention can actually be instituted. By the age of 40, and we now emphasize this for both men and women. Earlier, we just used to say men, but heart attacks being the commonest cause of death also in women, we now emphasize that say men by the age of 30 and women by the age of 40 should identify if they've got any risk factors by going at a single visit to a doctor, identification of risk factors, and then being able to control those risk factors in time. As long as we control our risk factors, we would actually be decreasing our risk of heart attack immensely down to 50% even by control of risk factors.
Right, right. I think you've made some very crucial points, sir, and I'm sure, at least I am, and the audience is definitely more knowledgeable about how to keep our heart healthy. And most of it, as you said, is about lifestyle choices, the everyday choices that we have to make to look after our heart. I'd again like to thank you, sir, for taking our time and speaking to me. Thank you so much.
Yeah, it's a pleasure talking to you. You've always been very knowledgeable and your programs are extremely good.
Thank you. Thank you so much, sir.